Welcome everyone to the next edition of the Care CEO Success Stories podcast. My name is Adam James of Spring Up PR, and for those who don't know, if you don't know about our podcast already, we celebrate and showcase the leading CEOs in the care sector who talk about what they consider their single biggest achievement. So that's really the focus of these episodes. We've had some great previous episodes. We've got some great episodes lined up. Make sure you subscribe and do all the nice things, like it, give us a review, and we'll make sure that we'll give you a little extra shout out if you can help support us in that respect. So this episode we feature and have with us Tony Stein. He is the CEO of Healthcare Management Solutions, which is the UK's largest professional management company for the care sector. And Tony has a wealth of experience. He's been in the sector for well over 20 years, and Healthcare Management Solutions have provided services to well over 750 care homes. Now, today, we're going to be delving into this wisdom that Tony has over these 20 years, and the wisdom that he has gained, particularly working for these 20 years, as I say, in the local authority funded spectrum of the care sector. So it's going to be a terrific episode. I'm very excited to be speaking with Tony. And before I do, just a quick little 2 minutes about Spring Up PR. If you don't know about us already, we help aspirational care providers get the recognition and fame they deserve via tailor-made PR and marketing strategies, ultimately to help either with inquiries or to recruit a great staff teams. So if you head over to springup-pr.com, you'll find a whole load of tips and videos and podcasts on how to achieve exactly that. Now, as I say, to coin the cliche, let's get straight into the episode. And as I say, we have Tony Stein here. So welcome, Tony. Why don't you start off by telling everyone a little bit more about who you are and what you do?
Hi, Adam, and thanks so much for inviting me onto the podcast. I'm very flattered to be here. Right, okay, so with a mixed background as an accountant and finance and various other bits and pieces, I found my way into the care sector as really a route to getting my first experience as an FD out in industry. And I happened to land into the care sector by accident. It was very fortunate for me because I've sort of found a home and I've really enjoyed it. We set up HCMS probably about 13 years ago, Kevin Groombridge and myself, my business partner, with a view to providing banks and IPs and operators and investors a route into owning care homes, but without having to actually operate them and having somebody who did know how to operate. One of the things that I will say is that whilst we've spent a lot of time operating, the private end of the market care, we've spent an awful lot more time, probably about 70% of our time, operating homes for local authority funded clients. And you asked me what my greatest success was, and I think it's hard for me to say that. I mean, obviously, I'm very, very proud of the team and what we do and what we've achieved over the years. But I think for me, what I've gained most personally is the 20 odd years of experience of operating homes in the sector allows me, I think, to be able to comment and to assess policy and potentially what might work best for the country in terms of delivering socially funded care, particularly to people who deserve to be looked after in their later life. And I can see, read reports that come out of government or can see comments made by health secretaries or prime ministers about the sector and can judge whether or not they have any possibility of success and whether what is being proposed is more political than perhaps social in its intent. Interestingly, I was having a conversation even today about Dilnot, and it came out of the fact that we've delayed the care cap again coming in, and the debate was about whether or not we as a nation have settled on the idea that we should be funding personal care for people beyond a cap. If you have the means to pay for your own care, why should the taxpayer pick it up? Only to protect perhaps your inheritance for your children or whatever. And whilst healthcare should be free at the point of need, I'm not sure personal care should be. The debate's yet to be had as far as I'm concerned. I'm not sure we've got there yet.
And just go back to when you started Healthcare Management Solutions and the issues at that time. I mean, there's always, we were talking before as we were chatting before we pressed record on this episode of the permanent many crises there seems to be in the sector. But can I go back to 18, 20 years ago? What was pressing then at that time?
Well, it's slightly different because 18, 20 years ago when I first came in, I owned a company called NHP. And NHP was one of these phenomenal success stories in its early days. It became the biggest single owner of care homes in the country, but it almost was a victim of its own success. And there were lots of failures that came out of that. And ultimately, a lot of the assets that were rolled into the NHP estate eventually got rolled into what became Southern Cross, and then the failure that ensued as a result of that. And that was there were a lot of things wrong at that time. What was wrong at that time was that people who were property developers, people who had land that they didn't know what to do with, builders, they built care homes because actually it was easy money. We used to joke and say you could literally knock a dog kennel up. If you wrote care home over it, it'd be full by the evening. And it wasn't far away from that. And actually we got a very bad reputation in the sector, I think, in those years. The 90s were particularly bad. But we set up HCMS as a consequence of the crash in 2008, when insolvency practitioners and banks were finding that they were unwitting operators of care homes that they didn't really want to run. And they needed professional services to help to run them. And so we set this business up to do that. So if you came and looked at HCMS today, HCMS looks like the back office of any major operator. At one point, we were running 125 services. We're now running about 67 services. And it fluctuates all the time. But the problems have been the same for a long time. And the biggest problem in the sector at the moment, I've always said this, is the split funding. The split between the NHS for healthcare and the local authorities for social care. And, everybody today has got their head in their hands talking about long wait times to get into hospitals, blocked beds in hospitals, people awaiting discharge that are fit for discharge. And yet we've got empty beds in the care sector. Now, from a UK PLC point of view, that makes absolutely no sense. And from an individual point of view, it also makes no sense because people don't get what they need in hospital. If they're fit for discharge, they need to be out into a different environment. And I've just been through the same with my own mother, who sadly has just passed away, but she spent 7 weeks in hospital with no medical condition that needed treating, when actually what she needed was to be out in a care setting where she was getting daily physio and back on her feet and mobile again. And actually she didn't get that because she was in an NHS setting and the staff were rushed off their feet and didn't have the time for her. And all that did was it made her immobile and effectively shortened her days, which is it's a terrible thing, when you think about it. But the point I'm trying to get to is this, that we all know this, that I think the latest numbers say that on average care homes are 84% full, so there's 16% of the capacity not being used, and yet the hospitals are rammed to the rafters. And it's not rammed to the rafters with people needing immediate urgent medical attention, it's rammed to the rafters with people who actually are probably needing to be in a different setting. That's the thing that needs addressing most of all at the moment. I was told, I don't know how true this was, that when Margaret Thatcher was in power, that one of the things that she had on her list was centralising the funding for social care, but actually she capitulated to pressure from local government to leave them with that budget, because clearly it works better for local authorities to have all that extra cash coming in and going out, because it gives them a better ability to balance their book.
Tell me, let's get straight into it. If you were in charge, what would you do? Have you got an answer or I'm not saying like an answer is somehow you wave a wand and and you have an answer. It's never, ever, ever, ever is anything as simple like that. But if you had your way in terms of pushing forwards genuine changes, what would they be?
I think there's a few things, Adam, and I think the first and foremost thing I would say is that I would combine the funding, not the implementation or commissioning of care, which needs to be local, but I think the funding of care needs to be national. And I think if we could get to that point, then I think that releases all kinds of pressures within the system. That's the first thing I would do. The second thing that I would do is I would start to, if you like, be a bit more prescriptive about how our regulator works, and get the regulator to focus back in on their primary function, which is to ensure safe and compliant care. It's to be in and out of care services on a regular basis, making sure that the services that people are operating are fit and are safe, and that people are getting a good quality of care. And I think the regulator gets involved in many areas that it has absolutely no reason to be in whatsoever. And a good example of that at the moment is support right care, right culture. So their decision about only registering services for people with LD and autism for 6 people or less, which is a guideline which they adhere to very strictly, it makes no sense, because people have the right to choose where they live and who they live with. And if they want to live in a larger setting, that's entirely their right. It's a fundamental human right. In the same way that you or I could go and live on a kibbutz if we wanted to, then people with other challenges have the right, if they choose, to live in a small community. But because they won't register those as small communities, it takes that choice away, and that can't be right. So I think, and what annoys me is that they get involved in making decisions like that at a time when 45% of good rated care homes haven't had a visit for 3 years. That's not acceptable. I think the public need to see boots on the ground. They want to know that the regulator is in and out of services. So I think change the funding, start to get the regulators to focus in on their primary function again, give good contemporary information to people about the quality of care in services, and come down hard on operators that actually are not fit to operate. We see probably more than most, because we tend to get involved in the more distressed side of the market. My team have had boots into far too many services in the past 13 years that frankly were not fit to operate. And those were services that often had good ratings from CQC, and that's not acceptable. That's not what this is about. I'd like to see that change.
Just going back to the national funding, tell me more about this. How would this operate in practice?
So I think that the way it needs to work is, first of all, I have to say, I think the rolling back on the 1.25% of national insurance, the care levy, was a bad idea. I think that's an absolutely terrible idea. I think we should have gone ahead with that, by the way. But I think having central funding, if somebody has a healthcare need and that need is assessed against a national set of standards that is well understood, then I think if that funding isn't then coming out of the pockets of the local authority, then there's a chance that those people who are properly assessed against those measures and who need care will get it. At the moment, if you live in certain local authority areas, your chances of getting awarded your care package, your financial care package, by the local authority is much, much slimmer than if you live in a much wealthier local authority area. And that, again, that postcode lottery about care has to come to an end. So it doesn't matter where you live, you should be able to draw from that fund. And that fund needs to be a central fund. But local commissioning is absolutely fine, because, I think there are local differences in how commissioning needs to take place, because some places, particularly inner city areas, that have got a very, very high number of people who probably fall into the socially funded category, have got different challenges than, if you look in certain home county areas, perhaps.
So in terms of the funding, then, it's effectively, just go into a little bit more how you envisage the best way to fund.
In the same way that the NHS is funded by central government, you would have a social care service that was funded out of central government, but you would still have local social workers involved in assessing the needs according to a national plan. And I think that's the way I would see it, so that it doesn't matter whether you were living in Birmingham or whether you were living in Henley-on-Thames. You would still have the same assessment, you still got the same kind of payments awarded to spend on your care.
So a specific levy taxation for social care.
Yeah, I think it's essential because, we know we're a growing older population. And one of the key things about the sector, and it's been said so many times, there's nothing new here, but when the NHS was set up, it was set up in a different era with different medical solutions that were available. So now what we have people who live longer with more chronic conditions that need quite expensive treatments often. And we're an aging population, so there are fewer people paying for that. So, all of the dynamics are changing, and yet we've still got similar systems to what we had before, and that can't work. So there has to be a change to that.
And politically, what do you think would be required for that to be enacted?
Well, politically, we'd have to get rid of the political system that we have, because the problem is decisions, I think, are made at government level that work for the benefit of the government in power and not for society. So, for example, if you look at the decision to perhaps protect people's life savings and their assets, their equity, and by capping their personal care costs, for most of the people who go into social care, it's irrelevant because they haven't got anything to protect. So actually, you're appealing to a certain demographic, and I suspect that there's a bit of a conservative bias towards that. I mean, I'm an unapologetic conservative, but I just think sometimes decisions are made for political reasons rather than for practical and social.
I see. So do you think that it could be, just talking about the politics of this being a vote winner or not, the provision of good care for our ever-increasing elderly population, for all our mums and dads and aunts and uncles, and a specific central fund to that, which mean more money on taxation, possibly? Do you think that can be a vote winner?
Yeah, I do. And especially, and it makes me wonder about the Conservative Party sometimes, because, we talked at the last election about the Red Wall and how they'd broken through and all this sort of stuff. Actually, this is the kind of policy that says we're no longer going to leave you at the mercy of the postcode lottery. That if you live in Birmingham, you've got needs, social care needs, and they're assessed, that you'll go on a portal and the lowest bidder basically gets to look after you, if you're lucky. Whereas if you live in sunny Surrey or whatever, you are much better cared for and you'll get a package of care. I think if people felt that the government understood all of this and wanted to give everybody the same and equal access to funding, I think that would help. And the other thing is that if you think about social care and healthcare, there's a massive gap here. In healthcare, if you got up now from your chair, walked out the room, fell over and broke your leg, you'd simply turn up at hospital and somebody would sort you out. It might take you 5 hours or whatever, but somebody eventually would get around to looking after you. The thing is now, if you're an elderly person and you develop a need, a social personal care need that needs to be resolved, the route into getting that is so bloody complicated and dependent on so many people doing so many assessments that actually it becomes a nightmare in itself. You've got the problem of being old, of being a little bit out of touch with modern technology, getting on the web, talking to people on the phone, especially if you're hard of hearing. And then you've got to find your way through this maze of red tape to try and get any assistance. And it could be done better.
Yeah. And tell me, Tony, do you see anywhere in the world that you look at and think, okay, well, there's a better system. That's where we should be looking towards?
I'm not sure we should just go out and look around the world and copy. I think we've got our own specific challenges. I think if you look at the German system, I like elements of that. I like the way that Germany went to the people and they made a decision as a population that they were happy to pay another 1.25% in taxes to pay for this. So they went down that route in the same way that I thought we had and said, we are prepared as a people to suffer that burden, but to make sure that everybody gets the care they need. I think the thing that we need to do here is we need to get to a simpler, more accessible solution. And I like the menu kind of route where you've got a checklist that says you are unable to get out of bed on your your own unassisted in the morning. You need assistance with dressing. You need some assistance with preparing food and maybe even with eating and so on. And so if you tick all those boxes, that it equates to, let's just say, £700 a week. And the German system allows you to say, well, actually, we'll give you £500 a week in cash and a family member can provide that, or we'll give you £700 a week and you can spend that on the services that you need. And I think if people had that and it was clear, so it doesn't matter whether you live in Surrey or Sunderland, you get what you get from that menu and it's clear. It's that's what you need. Then I think that's fair and people can understand it and it becomes accessible. Whereas at the moment, I think there's a big fog around funding for care.
Yeah, I mean, it evidently needs to happen. These changes needs to happen. And it's like, how much longer with our increasing elderly population, how long can it just continue as it is? Because
it doesn't work, does it?
Everyone on the ground can see it. Alarm bells are ringing, and yet.
But at a time when the national budget stretched, is that and rightly, I think they've said no. Would it be right to be saying, well, at this point we'll start to cap personal care costs, and we'll step in as the government beyond 86,000 or whatever the number is, and we'll fund it? I don't think the answer to that is yes. I think the answer to that is no. We're not in a position financially to do that at the moment. Maybe in the future we will be, but certainly not now. But anyway, going back to, I suppose, the original point, which is how do we improve this? I think the other thing is that we have to weed out operators that shouldn't be operating, that actually don't really get and understand what proper care is all about. And there are sadly a few of those still around. And we every time there's a disaster and there's abuse and there's poor care rooted out and there's another expose on Panorama, we all wail about we'll learn the lessons. But actually, do we really learn the lessons?
And how do you think we can do that?
Well, I think that comes back to my point, which is I think the way the regulator operates isn't the way that the man on the street, should I say, thinks the regulator operates. I think the man on the street believes that the government carries out independent inspections of these services on a regular basis to make sure mummy isn't being harmed. And actually what happens is maybe after 3 years, they'll pop their head back in the door. In the meantime, they're just reliant on whistleblowers or complaints or safeguardings being raised or whatever. And that's not the same thing at all as actually being in the premises and actually seeing how people are being looked after. And I think we need to get back to that.
And your experience then, in terms of what might be a red flag from the very beginning about a provider not having the knowledge, the skills, the attributes, the dedication to ensure that quality standards are being met.
Yeah, this is a really tricky one, and this I have some sympathy with CQC about, because you've got to have a system that allows first-time entrants to the market. However, running a care home isn't the same as running a hotel, and running a care home is not like any other business. It's a very highly regulated business, and rightly so. And I think the investors, need either to have very experienced people who can demonstrate that level of experience, not just chat through a quick, sort of interview, but demonstrate that they've got significant experience in what they're doing and how they do it, and that they've never been found wanting. I think that's the difficulty. It's very, very hard to do. But in fairness, what I tend to see, people who've run care homes for a long time, who haven't really moved with the times, and they're still running workhouses, for want of a better word, instead of care homes, and they're still going. And I think the regulators have got the teeth to stop that. There's an element of they need to do a bit more of it, I think.
Yeah, I mean, I think, those of us who have some kind of close knowledge of the sector there are signs that someone's, usually the owners, to be frank, aren't just a good fit. Yeah, ultimately, tell me what you think. The owners are the ones who lead the culture, the vision, the homes, and they're the ones who appoint good managers. They're the ones who build teams up, help the managers to build teams up.
But they're also
it comes down to them, doesn't it? Really.
But they're also the ones generally that have got the hands on the purse strings, and the ones that dictate staffing levels, that dictate the reinvestment in in the assets and so on.
Mm.
And there are lots of very tired, very poor quality assets out there at the moment.
Mm.
Now, part of that problem is that local authorities aren't capable of delivering, if not good fees, good steady levels of occupancy. And unless you've got one or the other or both, then investors won't come into the market and replace those tired old horrible assets with new purpose-built, fit for purpose care homes. So we've got a lot of stuff out there at the moment, particularly these very old conversions with extensions that have got narrow corridors and very small. And I'm not worried about. I'll come back to this in a moment. But when I say small rooms, I mean rooms that are inappropriate for the care that's needed to be delivered. And I think those need to go. And the only way that you're going to get replacements for that is to start to be able to guarantee a good level of or reasonable level of return to investors to build for that. And at the moment, there just isn't the return. I'll come back to the point about size. Again, my point here is not for anybody in government to tell you, me, or anybody else of an age that they have to live in a large bedroom, that they have to have outside space, that they have to have anything. It's personal choice. If I want to live in an attic room in a city centre property with no garden, that's my choice. And I should be allowed to make that choice, even if nobody thinks it's a good idea. I should be allowed to make that choice. What the CQC should do is, in inspecting that service when you're in it, they will then be able to say, well, actually, the operator, for example, has put you in a room, but they can't deliver your care properly in that room. So now there's a problem with the operator and the way it's being operated. But nothing should stop the operator, if he wants, opening up a home that's got 9 square metre rooms with no ensuite. If they're mad enough to do that and people want to go and live there, then that's the market.
Yeah, and tell me, so I just, as I speak to you, I'm just going to be kind of flippant in how I characterize this. But in a sense, if you have, if you are running a provider care homes in an affluent area, you can afford to have high fees, you can afford maybe to pay your staff more, and you have more like a hotel, a high-end hotel, and you can command high fees. Is that a whole lot easier than running a local authority predominantly funded home that is just wanting to get a good quality service?
It's two different businesses. This sector has always been two different, completely different businesses. If you're running £1,500, £1,600, £1,700 a week fee care homes, and it's private, so you can dictate your price. You've always been running a different kind of business completely to one where you're a price taker. You're getting £600 a week, but the CQC regulations, again, rightly so, apply equally to both of you. It's, there should be awards. If you see the awards that keep going on in the sector, it's, well, who's won the award for best care home? Well, it's probably some 5-star hotel style service operator. The reality is that there should be a separate award for people who actually manage to deliver phenomenal care on a local authority budget, because it's a very different job.
Yeah, it's kind of two tiers. That's a really good point that you make, and I think that obviously those in the sector just know that they can see they are just two very different models, as you said.
Yeah, it's interesting because you then get into all sorts of little moral arguments about there are operators at the top end of the market where when the money runs out, they will evict you effectively, leave. We've never ever done that with a private client. I'm proud to say that if we've had the benefit of your life savings, effectively, when that money runs out, we'll continue to look after you. It's very, very hard to do from a financial point of view sometimes because your average fee suddenly drops. But I think there's a moral side to it that some care home operators now are saying, well, we can't afford that. We can't afford to have that kind of level of morals.
So, Tony, this is a great conversation, a great episode.
Deep,
now,
isn't it?
Yeah, and the big important issues which we as a nation face is just going back to our original, the 20 years, the wisdom that you've gained. Is there anything you'd like to add that we've not touched on up to now?
I think, we glibly talk about this being a business, and not glibly, that's the wrong word. I think we often talk about how important people are in businesses, never more so than in this business. That caring is a vocation first and foremost. It's not a profession, it's a calling. You can be the brightest nurse on the planet, but if you don't care about people, it doesn't work. Similarly, as a carer, I've had the absolute privilege of being a judge in some of the competitions around and about for, Carer of the Year and that kind of thing. And the stories that these people tell, so moving, with people who have spent their entire working life up to retirement and beyond, delivering care for very, very low pay and spending their spare time going to visit residents in hospital, attending funerals for residents that have died on their days off, people who genuinely care for others. And I think as a nation, it's so sad that in this world of celebrity and money, that we think more of a pop star or a footballer than we do of a carer. Isn't that the tragedy of today's society? Genuinely, that is the tragedy. I wish that we valued people for what they genuinely did for others rather than for what they were worth.
Yeah, well, I mean, I think that's a great, appropriate way to end this episode. But Tony, if people want to get in touch with you, how can they do that?
Well, I'm pretty out there, so most people would generally know. But I mean, by all means, if people want to get hold of me, tony.stein@hcsolutions.co.uk is the best way. And I'd look forward to hearing from anybody and everybody. In fact, I love to chat about the sector, as you can probably gather. I love to learn as well. So if you've got some knowledge to impart, give me a call.
That's great. I know that you're very active on LinkedIn, so and that's certainly where people can keep an eye on everything and what you have to say. That's a great way for people to find out a little bit more about you and healthcare management solutions too. In fact, I've got one final question. For those who, as you said right from the very, very top, have, maybe are contractors, are kind of builders, or have worked in property and then decide, oh yeah, I like the idea of running a care homes. What do you have to say to them? What advice or tips would you have for them?
Don't do it. That would be the first one. But I think joking apart, I would say, please, if you are thinking about investing into this sector, get some really good advice before you do. You can make some very awful mistakes. And also, I don't mean just advice about what you're buying, but also advice about how to run it. Because there are lots of people out there in the sector who've had time in the sector, who talk the talk, but actually are not that screwed together when it comes to running care homes. It's very, very difficult. It's harder than anybody can imagine.
Yeah, sure. Great. Tony, thank you very much for being our guest.
Thank you very much.